President Roosevelt had decided was too hard. And I'm glad he did Social Security. And President Truman tried, but ran into a brick wall. And President Johnson gave us Medicare and Medicaid, but trying to take on the entire healthcare system just wasn't in the cards. So we tried, and we were not successful. But I think you sometimes learn more about a person when you see what they do in face of failure. What happens when they don't get it. And so I got back to work. Some people said, well, she'll never talk about health care again, but that's not how I'm made. So I decided, well, let's try to help some people anyway. So I helped to create the Vaccines for Children program, and now every year in Iowa, 225,000 children in this state have access to vaccinations against childhood diseases. And then we went to work to tell the drug companies they had to start testing drugs that would determine whether they were safe and effective for kids, because up until then, they either did or they didn't, depending upon their choice. And so we were prescribing drugs to children without really knowing whether or not that was right. Well, the drug companies weren't happy about it, but I was able to convince the FDA to put in a rule. The drug companies sued. They overturned the rule. So when I became a senator, I had the great pleasure of going to the Senate and passing a law to require drug companies to do what they should have done all along. Test those drugs on our kids before you just give them to them. Let's find out whether they're safe and effective. And I worked to expand research into breast cancer and to raise visibility about other cancers and other diseases. And then I took on what to me has been one of my primary concerns my entire life, and that is whether we give kids health care. So I helped to create the Children's Health Insurance Program. And the good news is that today in Iowa, under the program you know as the Hawkeye program, 50,000 children have access to health care. 6 million across America. Well, the not so good news is that there are still 50,000 children in Iowa. They're not poor enough to qualify for free care, but their families who are working people don't make enough money to buy health care, don't have an employer to help them, don't have a union contract to guarantee it. And there are 9 million around the country in a similar position. Now, we've been working on a bipartisan basis in the Senate to actually provide additional health care and to pay for it. The President has vetoed our efforts twice. So I cannot wait until I am President, and I will ask the Congress to send me that bill so that I can sign it, and we can take care of more children in Iowa and across America.